Guys, welcome to Pioneer Advanced Hair Transplant Center. Well, today we are talking about a video how to handle what are the protocols for someone who's suffering from class 6 type of Norwood's classification or class 6 type of baldness. Well, usually when these kind of patients, when they walk into the clinic, what can happen during the consultation? What are the plans? What are the patient goals? What are the surgery side challenges? We are going to discuss in this video along with a live example of a patient with the results. I would like to thank this patient very much because a lot of efforts we made to make this video, because it took almost more than 13-14 months to make this video and saving the data, because it's not that easy to keep the data on every time and put it this way. And I'm very thankful to this patient also. Kindly watch this video until end to understand what are the protocols that we supposed to follow to achieve one of the best results with these kind of surgeries. Kindly watch the video until end to understand what are the protocols that we need to follow from surgeon side, what are the protocols that patient supposed to follow to achieve a reasonably good density in class 6 type of baldness. Well, when he walked into my consultation, this man is around 36 years with having class 6 type of baldness. And patient had in his mind, he want head full of coverage. And challenges from our side was a kind of a class 6 baldness and donor is average. And that was my challenge from our side. Patient side goals were, he was okay to come for 2 or more sessions. And he was okay to the plan that I'm going to take little higher hairline to conserve or save the grafts. So these are the things actually happened in the consultation. Well, here usually the patient is not happy to get the hairline, little higher hairline. Here in this case, I'm sure this transplant might go totally flop or go to a toss because he is accepted for that plan, which is going to be successful. And with thousands of surgeries experience, expertise, I suggested him that way. So all this went well, and patient also had a motivation to get it done with the best surgeon. So all these three kind of we executed the plan. First session went very well with around 3,500 grafts. Well, after 8 months, it happened to see him for a review. We achieved the target results, whatever we planned in the first session, that getting a little more density in the frontal forelock area and taking the little higher hairline. Almost we covered more than 65 to 70% of the area. That's the prime motto we had in this patient before transplantation. Our idea is to do second session, especially in the crown area as well as frontal hairline little extension. That's the idea we had in our mind. That's what we discussed already. So, well, if you can notice, the results are really satisfactory. And second thing, if you notice, the donor is improved far better than the first time, because we have given him some multivitamin therapy. Most of the patients think that I would not take this medicine, I would not take this lotion and all. But well, when it comes to the guys who is having a less donor, I'm sure I'm going to recommend you a multivitamin therapy, no steroids, nothing. It's kind of only multivitamin therapy and minoxidil. And that's it. These two can really make a miracles in improving the donor. You can see this patient donor is excellently improved, and second time we can get best grafts better than first time. That's what it is. So we cannot really underestimate the medicines. I've seen hundreds and thousands of patients that who had got the best donor improvement with this multivitamin therapy. Kindly make a note and point of this. Using multivitamin therapy is really useful. Well, second session again we executed a plan implanting more grafts in the crown as well as the frontal hairline. That's the idea. Second session went very well, and let's observe the results once the final outcome appears. Well, we get to see final results after again 8 months. If you can notice the coverage and naturalness of the hairline, naturalness of the crown, so the fullness, density, blending, everything is kind of astonishing. And because this has happened because of the quality hair transplant. This hair transplant here, not only we achieved the results not only with the number of the graft, it is that artistic hands, expertise, a kind of a meticulous plan that we implemented to this patient really made best results, getting the density wise, naturalness. No one could even understand that he has done a transplant. And if you can observe in the donor area, donor still maintained. That's another important point. If you can see, the crown is just kind of cut about to any clinics, because the crown, we have different angulations and different orientation. So implantation, harvestation, all the steps should go very meticulously to achieve this kind of density. Overall, this is a very satisfactory. Patient was so happy that he got more than what he expected, and even is so astonished about the results. No one at his office or home identified that he had done a transplant. So the hairline density, naturalness, blending, mid-scalp density, and crown area blending to the existing hair, and donor management, all in this patient went very well. So that is the main reason why one should go to the quality clinics and quality surgeon to get best hair transplant. Conclusion of this kind of patients who has a class 5 or class 6 paralysis would always need second or even third session also. Fortunately, this patient did not go for third session, but there may be possibility that he would need third session also. Well, and patient always should have motivation to get it done with the best clinic. All the clinics definitely cannot give you this kind of results, because there's artistic hand and expertise involved in this. It's kind of a planning. Even if you remember first session when we made a plan, imagine if you take the hairline down, I'm sure this transplant must have gone to a task, the utterful of transplantation. That's the reason the patient should have motivation to understand what exactly your surgeon is talking about your case, and each transplant is totally different. So, well, all transplants are not the same, and whoever execute your plan very meticulous way, whoever understands your scalp, existing donor quality, scalp size, scalp measurements, and all this really matters to achieve best results. So that's the reason, guys, you really do your kind of research to understand which clinic is better and who's the expert as a hand that you're going to help you to get the good transplantation results. Then make up your choice to go to such clinics and get the transplant done. Thanks for watching video, and kindly do watch videos to understand more authenticated and more videos on hair transplant results. Thank you.